Representative, thanks for having us tonight. One thing when I begin, I'm a loyal, my name is Joe Remley, I'm from White Bear Lake. I'm a loyal conservative Republican. And I'd like to start by asking that young man with that sign over there if he could put it down. I didn't support Obama. I don't support President Obama, but I just find that uncomfortable. My concerns tonight have to do with a couple of things. Early on, we heard about the high profits corporations. I want to remind everyone that corporations cannot take your money. Corporations cannot take your property. Corporations cannot take your liberty. Only government can take your property. Only government can take your liberty. And only government can take your money. I was in Washington, D.C. recently, and it is a wonderful place to go. Representative McCollum's office was wonderful to us. They helped us get into facilities, helped us on tours, and they were very nice to us, even though we were Republicans. But the place is so large, so big, with so many responsibilities, there is just no perspective on what it takes to get almost anything done. We elect you, and immediately everybody here expects you to be an authority on just about everything in the world. It's not possible. And subsequently, it's not possible for the government to run a health care program. As much as we all would like it to be that way, it's just not possible. And I heard numbers over the last 3 or 4 months that 40 million people are without health care. Now, I seriously question those numbers. But tonight, that number has already ballooned to 60 million. And that ballooned in 2 months. So those are my concerns.
Well, first off, true confessions, I love Republicans. My mother was a Republican. The number that I used up to 60, and it's always good, and thank you for wanting to verify my numbers, is I used a number up to 60 of people who are either without insurance or underinsured. There's some people who have catastrophe insurance, but then it doesn't cover diabetic needs, insulin, syringes. It might only cover extreme hospitalizations. So I counted them as underinsured. Thank you for your comments about government. I happen to think that what we're talking about doing with holding the insurance companies accountable with some of the reforms that they've offered to do, finding a way to have accountability and transparency in that, and then looking to improve options to make sure and I think that there's going to be, in my opinion, a public option needed to make sure that there's a safety net plan that's there for individuals. It's going to mean that we have to be very vigilant. We have to hold the government to a high standard, and I thank you very much for sharing your concerns.
Okay. Hi, my name is Susan. I'm from Mendota Heights. Mrs. McCollum, I've voted for you in the past. I attended my Democratic Precinct Caucus this year. I'm telling you right now, though, I do go to Tea Party meetings because I'm